Have you ever ignored an itch? Brushed it off as dry skin, laundry detergent, maybe even aging? If you're over 60, you've probably done it more times than you can count. And most of the time, yes, it's nothing serious. But what if I told you that in some rare but very real cases, that little itch could be your body's first warning sign of something far more dangerous? Something like cancer. I know that might sound dramatic, but as a doctor who's worked with older adults for over 30 years, I've seen it happen again and again. People come in for something minor, an itch that won't go away, a patch of skin that tingles, and by the time we run tests, we find something that had been growing silently inside them for months. No pain, no lumps, no obvious sign, just an itch. This video is not here to scare you. It's here to inform you. Because what most people don't realize is that certain types of cancer, especially in older adults, can cause symptoms that seem completely unrelated at first. In fact, studies have shown that some blood cancers, liver issues, pancreatic tumors, even breast cancer, can trigger what's called paraneoplastic itch. That means your body is reacting to inflammation or cell changes long before anything shows up on a scan. And that reaction often starts as a persistent itch in very specific places, with no rash, no visible irritation. So if you've been reaching for lotion every night, wondering why nothing seems to work, if you, or someone you care about, has a strange spot that keeps itching, even though it looks perfectly normal, it's time to listen. Because today, we're going to talk about 5 places on your body where itching can be an early warning sign of something serious. Not every itch is dangerous, but when it follows a certain pattern, deep, constant, unrelieved, it might be your body's quiet way of saying something's not right. And if we listen early, we just might change the outcome. Let's begin. Let's begin with one of the most common and most overlooked warning signs: persistent itching on the lower legs, especially the shins or calves. For most people over 60, it's easy to blame this on dry skin or aging. You might even think, maybe I forgot to moisturize. But when that itch becomes constant, when it lingers for weeks or even months, and especially if it doesn't respond to creams or lotions, it could be something more. In recent years, doctors have noticed a consistent pattern. Unexplained itching in the lower legs is one of the earliest signs of blood-related cancers, particularly lymphoma. Why the legs? It turns out that certain types of lymphoma affect the lymphatic system, which is responsible for moving fluids and fighting infection throughout your body. As the disease progresses, even in early stages, it can trigger your immune system to release histamines and inflammatory chemicals into the bloodstream. These chemicals don't always cause visible symptoms. There might be no rash, no redness, just nerves firing under the skin. And because the lower legs have a dense network of peripheral nerves, that's where the sensation often shows up first. I'll tell you a story. George, a 75-year-old former electrician, came to the clinic one winter complaining about his legs burning with itch every evening. He had tried every lotion on the shelf, changed his laundry detergent, even replaced his carpet. Nothing worked. The skin on his shins looked completely normal, but his story stood out. The itch wasn't going away. It was keeping him up at night. So we ordered a blood test. His white cell count was off. A follow-up scan showed swollen lymph nodes, some deep in the chest, too far to feel by touch. George was diagnosed with early-stage Hodgkin's lymphoma. His only symptom for 6 months? That itch. Here's what you need to know. If the skin looks normal, but the itch is deep, constant, and doesn't respond to skin treatment, it's not just dryness. Especially if you notice other signs like unexplained weight loss, fatigue, night sweats. Don't wait. Bring it up with your doctor. Because sometimes the legs are where cancer starts to whisper, and catching it early could change everything. Now let's move upward to an area many people never expect: the upper back, specifically the space between the shoulder blades. This kind of itch is tricky. It often feels deep, like it's coming from under the skin, not on the surface. People describe it as something they can't quite reach, or that scratching doesn't help at all. And unlike dry skin, it doesn't flake or show redness. So, what could cause it? Surprisingly, this kind of itch has been linked to pancreatic cancer, especially when it occurs months before any digestive or pain-related symptoms begin. Here's how that works. As tumors develop in the pancreas, they can block the bile ducts, small tubes that help transport bile from your liver into the intestines. When bile backs up, bile salts start accumulating in your bloodstream. And those salts, they irritate nerve endings. Not just anywhere, but in places with dense sensory nerve clusters. And one of those is, you guessed it, the upper back. Let me share the story of Linda, a 70-year-old woman who thought she had a weird muscle itch. For 3 months, she woke up at night scratching her shoulder blades. She changed her pillow, switched laundry detergent, bought a new mattress pad. Nothing worked. Then, during a routine blood test for fatigue, her liver enzyme levels came back high. Further scans revealed a small tumor in her pancreas, pressing against her bile duct. The only sign her body gave her before blood work? That stubborn, deep upper back itch. Pancreatic cancer is known as a silent disease because it rarely causes obvious symptoms until it's advanced. But in many older adults, this odd upper back itch is one of the first clues. So how do you know when to be concerned? Ask yourself these questions. Is the itch focused in one small area between the shoulders? Does it feel internal, like it's under the skin? Has it lasted more than a few weeks? Does lotion, cream, or scratching have no real effect? Are you noticing other changes, like darker urine or fatigue? If you answered yes to 2 or more, speak up. Don't be afraid to mention it to your doctor, even if it feels like a small or silly complaint. Linda almost didn't bring it up, but her choice to speak saved her life. Remember, your back might be trying to tell you what your stomach can't. Listen early. Act sooner. It could make all the difference. Let's move to the next silent signal your body might be sending. An itchy scalp, with no dandruff, redness, or visible irritation. This may sound minor, but for seniors over 60, it could be one of the earliest signs of a more serious underlying issue, especially when the itch comes back daily, moves around the scalp, feels like tingling or crawling, and doesn't respond to any shampoo, oil, or cream. What makes this especially important is how non-obvious it is. Most people chalk it up to dry weather, aging skin, or a hat that irritated the scalp. But when the usual fixes don't help, and the itching continues, especially in the same spot, it could be a sign of blood-related cancers like leukemia, or even skin cancer beginning to form beneath the surface. Take the case of Henry, 73. He was a healthy, active grandfather who started noticing his scalp itching every afternoon, a deep itch with no flakes or visible irritation. He changed shampoos, stopped wearing hats, even started moisturizing his scalp daily. Nothing helped. When he finally mentioned it during a checkup, mostly because he also felt more tired than usual, his doctor ran some blood tests. They revealed elevated white blood cell counts. A bone marrow biopsy later confirmed early-stage chronic lymphocytic leukemia. Henry's itchy scalp had been his only warning sign, and thanks to that small complaint, he caught the disease early. In other cases, persistent scalp itching could be related to skin cancer, especially in areas with thinning hair. It may look like a small bump or a dry patch, but if it itches in the same spot every day and doesn't heal, it's worth having a dermatologist examine it under proper light. And here's the truth. The scalp is one of the hardest places to self-examine, especially if you live alone or have limited mobility. That's why it's helpful to ask someone, a spouse, caregiver, or even your hairdresser, to check the area if you're concerned. If you've had an itchy scalp for more than 2 weeks and it doesn't go away no matter what you try, it's time to listen to your body. It may seem small, but as we've learned from thousands of older adults, cancer often whispers before it screams. This could be your early clue. Don't ignore it. Now let's talk about one of the most overlooked and emotionally difficult places where itching might carry a serious message: the chest or breast area. This applies to both women and men, although it's more frequently discussed in women's health. But in either case, If you're over 60 and notice persistent, localized itching around the nipple, beneath the breast, or across the upper chest, and it doesn't go away with creams or detergent changes, it could be much more than just skin irritation. One of the early warning signs of inflammatory breast cancer, a rare but aggressive form, is not a lump, but a nagging, persistent itch in the breast area. Often, the skin looks slightly reddish or irritated. It may feel thickened or warmer than usual, but there's no clear rash or external cause. I remember the story of Ruth, age 69. She had what she described as a weird itch around her right breast. She tried different bras, changed detergents, went without a bra for a week. Nothing helped. She thought maybe it was just sensitive skin from aging, but the itch returned every day, in the exact same place. When she finally went to her doctor, there was no lump to be felt, but a closer look showed skin dimpling, and a diagnostic scan revealed a small tumor pressing close to the surface. Her diagnosis: inflammatory breast cancer. And the itching? It was her only warning sign. Now here's what makes this so critical. Inflammatory cancers often don't form classic round lumps. They grow along the skin and lymph channels, which can change texture or cause irritation long before anything obvious appears. And it's not just breast tissue. Sometimes itching on the chest or underarm can point to swollen lymph nodes, which may be early signs of lymphoma or another systemic issue. For men, this warning is even more easily missed. Male breast cancer is rare, but it does happen, and it often presents as an itchy patch, a persistent twinge under the chest muscle, or a small, rough area near the nipple. So whether it's a sharp itch beneath the breast, a strange sensation across your chest, or a feeling that something just isn't right, do not ignore it, especially if it stays in one spot. It doesn't respond to lotion or fabric changes, and it's been more than 2 weeks. Remember, the skin is your messenger. If it's speaking up day after day, it's doing so for a reason. And catching a warning sign early here could literally save your life. Let's address one of the most uncomfortable and most ignored warning signs, especially among older adults: persistent itching in the anal or genital area. It's an awkward topic. People hesitate to talk about it, even with their doctor. Many assume it's hygiene-related, a soap allergy, a diaper issue, or just part of getting older. But when itching in this sensitive area becomes chronic, localized, and resistant to treatment, it's not just an annoyance. It might be a red flag. For seniors, this kind of itching could be a quiet early symptom of cancer, including anal cancer, vulvar cancer in women, penile cancer in men, or even underlying lymphatic or skin malignancies in the area. Let me tell you about Eugene, a 76-year-old man who thought he had persistent hemorrhoids. He experienced a raw, itchy sensation that came and went for months. He used creams, he changed his diet, he even assumed it was just aging skin. But it didn't stop. Eventually, he saw a colorectal specialist. A quick internal scope revealed a small lesion on his anal canal wall. Biopsy confirmed the early stages of anal cancer. It had been growing silently, and the itching was the only early symptom. For women, it's a similar story. Vulvar cancer is rare, but becomes more common after age 60. And in many cases, the very first symptom is not pain, not bleeding, but a persistent itch near the outer genitals or just inside the vaginal area. It may appear as a rough or thickened patch of skin, slight discoloration or scaling, a burning sensation that worsens at night, or no visible sign at all, just that relentless itch. One woman, Carol, age 71, said she spent almost a year trying to manage a weird itching under her panty line. She blamed pads, heat, tight clothing. Nothing worked. It wasn't until a pelvic exam, which she nearly skipped, that her doctor found early vulvar cancer. Here's what makes this warning sign so dangerous. Most people would rather suffer in silence than bring up a private itch. But silence is far more dangerous than embarrassment. This part of the body is filled with nerve endings and lymphatic pathways. When something abnormal begins growing, even deep beneath the skin, the nerves can be the first responders, alerting us through persistent discomfort. So if you or someone you love is over 60 and experiencing ongoing itching in the same spot, no visible rash, bug bite, or skin issue, no relief from creams, hygiene changes, or fabric swaps, and especially if it's one-sided or paired with swelling or sensitivity, please don't ignore it. See a doctor. Mention the pattern. Ask about a deeper exam. Because in many of these cases, the difference between early detection and advanced disease is simply speaking up about something that seems too small to matter. It matters. And your peace of mind is worth the moment of courage it takes to talk about it. Let's take a moment to breathe and reflect. We've just walked through 5 surprising, even uncomfortable, signs that your body may be trying to warn you about something serious. And none of them involved pain, bleeding, or lumps. They involved itching. Not random, everyday itches, but specific, persistent, unexplained discomfort in areas your body doesn't normally call attention to, at least not for weeks or months at a time. Let's quickly review. 1. Lower legs. An itch that lingers, often linked to blood cancers like lymphoma. 2. Upper back, between the shoulder blades, often tied to early pancreatic issues or bile buildup. 3. Scalp. No flakes, no dandruff, but a crawling, burning itch possibly tied to leukemia or scalp-related skin cancers. 4. Chest or breast area. A stubborn, focused itch that could be an early symptom of inflammatory breast cancer. 5. Genital or anal region. Easily dismissed, but sometimes the first sign of hidden cancers in vulnerable, sensitive tissue. Now here's the truth. No one tells us enough as we age. Your body is always speaking, but it speaks softer the older we get. The whispers become harder to hear. The symptoms are easier to dismiss. But those whispers matter. Older adults often don't feel sharp pain. We often don't show extreme swelling. But the nerves, the immune system, and the lymphatic network, they still send signals. And sometimes those signals come in the form of an itch that refuses to go away. So what can you do? 1. Don't panic, but pay attention. Most itching is harmless. But when it sticks around, when it doesn't respond to treatments, when it feels like it's coming from under the skin, that's your cue. 2. Track the pattern. When does it happen? Is it in the same spot? Does it worsen at night? Does lotion help? Or not at all? 3. Speak up. Even if it feels minor or silly. Bring it to your doctor's attention. Ask for blood work. Ask for a skin check. Ask for peace of mind. Because here's the truth. Catching something early doesn't require fear. It requires awareness. Your body isn't trying to scare you. It's trying to protect you, if you'll listen. You've lived long enough to know when something doesn't feel quite right. Maybe it's not loud. Maybe it's not dramatic. Maybe it's just a faint tug. An itch you can't explain. A discomfort that won't quit. A whisper your body repeats again and again. And maybe you've been taught to ignore it, to tough it out, to assume it's just aging, to not make a fuss. But let's be clear about something, especially if you're over 60. Aging isn't the end of awareness. It's the height of it. It's the moment when small signs deserve bigger attention. Why? Because your body has been through decades of wear, repair, stress, strength, survival. And when it speaks now, it speaks with the wisdom of everything it's carried. That means when a symptom lingers, like a persistent itch, it might just be the first red flag. And responding early can change everything. It's not about living in fear. It's about choosing clarity over confusion, confidence over second guessing, early action over late regret. So here's what I hope you take from this. If something on your skin itches without cause, watch it. If it persists and resists normal care, speak up. If it's matched by fatigue, night sweats, or even the tiniest shift in how your body feels, don't wait. Get it checked. Ask questions. Honor your intuition, because your instincts got you this far, and they're not failing you now. They're just waiting for you to listen. You deserve answers. You deserve peace of mind, And if something's going on, you deserve to know while there's still time to change the outcome. Stay aware. Stay empowered. You're not too old to pay attention. You're too wise not to. If you've made it this far, it means something inside you is awake, alert, ready to act. And now, I want to ask you for something simple but powerful. Don't keep this to yourself. Because the truth is, someone you love, a parent, a sibling, a neighbor, a friend at church, might be living with one of these quiet signs right now. Scratching their legs every night, ignoring that odd itch on their back, brushing off discomfort because it's probably nothing. But it might be something. You could be the reason they get checked. You could be the reason they catch something early. You could be the reason they stay around longer. So here's what to do next. Comment below. Share one thing that stood out to you. One itchy spot, one insight, one lesson you'll take seriously. Hit the like button. It tells the platform this is information worth spreading. It helps others find it. Subscribe and turn on notifications. We create videos specifically for older adults like you to educate, empower, and encourage. Don't miss what comes next. Share this video. Text it to someone. Post it in a group. Email it to your adult children. Let this be the start of a conversation that saves a life. You don't have to be a doctor to protect your health. You just have to pay attention and help others do the same. Because knowledge isn't just power. It's peace of mind. It's prevention. It's love in action. Thank you for watching, and thank you for caring enough to learn.